Just a heads up, at the time we recorded this episode, the firings hadn't officially begun. But as of Tuesday evening, there have been reports of firings happening throughout HHS. We'll continue to cover this story in future episodes and issues as we find out more. Okay. Hello, Claire. Thank you for being with us today. Paul can't make it, so it will just be the girls. How was your weekend?
My weekend was good. It was beautiful. All the flowers are coming up here. It was like an 80-degree day on Saturday. And then yesterday I went down to the Delaware with my friend and sat by the water. It feels like change has come in. So I'm happy. Yeah, there's like bees and bugs out here, which is my second love. Second to journalism is bugs and critters. So I'm really happy.
I want to talk to you more about that because I'm very scared of bugs. So I think I need some of your influence to help me with that.
Yeah, I can influence you.
Awesome.
What about you? What'd you do?
I was telling you about this at our morning meeting. I was in Portland, Maine, and we literally had snow. So very different experience.
Yeah,
but
sorry about that.
Yeah, we just hung out, but it was a nice, fun weekend, just hanging out with friends and family. So it was good. But I will take us through this week's headlines. I'll jump right in. Our cover story this week was a Q&A with Jonathan W. Friedberg, director of the University of Rochester Wilmot Cancer Institute. And him and Paul talked about how Wilmot became the 73rd NCI designated cancer center. So that's definitely a big, exciting story. They had a really interesting conversation. So definitely check that out. We had a column by former NCI director Cameron Rathmell, one of her weekly columns, about supporting young people in oncology right now amidst all this uncertainty. Specifically, there are your listeners, junior colleagues. And we also had a guest editorial about the new Wheel Cancer Hub East by the scientific leads of the hub, which will focus on the connection between metabolism and anti-cancer immunity. The hub will. The guest editorial also spoke about that, but that will be the hub's focus. Today, we're going to dive deeper into two of our stories, our sort of weekly roundup, which is like 8 stories in one. And then later we're going to talk a little bit about my story about the DoD grants being facing severe funding cuts. Okay, so Claire, if you want to take the lead on the roundup, I know I had a couple sections in there, but it was mostly your labor, I guess. I've said that before, but you really took control of that one, thankfully.
Yeah. It felt kind of like, I know Paul's referred to it as kind of like a documentation, but this week really felt like a documentation because we had like RFK's kind of verbal attack on NIH that he put on social media. We put the whole transcript in there. We had American Cancer Society's response to the sweeping cuts at HHS. We had a fact sheet that was distributed to HHS employees listing all the consolidations and cuts, which is kind of the lead of the roundup, I would say, this week. And so they're all in there. Those transcripts are in the gray boxes. We just decided to include all the text to kind of document it as Paul says. The big thing from this week was, the sweeping NIH or the sweeping HHS, which includes NIH consolidations and cuts. ACS and American Cancer Society Cancer Action Network released this statement that was kind of outlining the consequences these changes could have on cancer programs. We had an update in there on Columbia's CCSG, and then we had mentioned the new appointments. So Bhattacharya is now, officially the director of NIH. Marty McCary is leading FDA, and then Trump's picks for Medicare and Medicaid, Mehmet Oz, the administrator position. I guess he had his went through the first step of the hearings. And then Susan Monterez was tapped for CDC to lead the agency. And then you covered the NIH Senate Forum and potential forthcoming tariffs on pharmaceuticals. So a lot of things going on. But yeah, the big story, the biggest takeaway is HHS. So combined with the previous staff cuts and resignations and retirements that have been happening, about a quarter of the department's entire workforce has been cut. There's been a complete reorganization of HHS, centralization of functions, consolidations of different HHS divisions. And the restructuring of of HHS is kind of it's more of the same, in accordance with President Trump's executive order, the DOGE, or the implementing the President's Department of Government Efficiency Workforce Optimization Initiative, which I always have to read because it is such a mouthful. But yeah, so from that internal document that was circulating, we got a couple of numbers, which is open to the public now. But so from 82,000 full-time employees, it's been reduced to 62,000 overall in HHS. 28 divisions will be consolidated to 15 divisions, and 10 regional offices will become 5. Wow. The CDC will decrease its workforce by about 2,400 employees. It's important to note that this restructuring is kind of coming at a time when the U.S. is grappling with one of the worst measles outbreaks in more than 2 decades. Bird flu is running kind of rampant. Several recent human cases. So, yeah, there's a lot going on, and it's all happening at once. But that was kind of like the lead of the roundup this week. Yeah. So.
Yeah, that's crazy. Sorry for my ignorance here, but I obviously knew about all of the restructuring and everything, but have people actually been fired yet?
I don't believe so.
Okay, so it's they're going to be though.
I don't hope I'm not giving you false facts, but I don't believe so. As of the publishing of this story, I haven't, looked into it much Monday morning, but this was just an announcement. And then, RFK, Robert F. Kennedy Jr. put out a response, like a 6-minute video on his Instagram, and just kind of, I guess, trying to provide further context for these sweeping, massive cuts and the restructuring. So we can get into that if you want to, but
yeah, please tell me about the video, because I didn't watch the full thing.
Sure. So he posted this video on March 27th, which was after these cuts were announced. And so he addressed everyone and said that he was pledging, to eliminate, he was fulfilling the promise of eliminating this alphabet soup of departments, which he likes to say, while still preserving core functions, merging them into a new organization called Administration for Healthy America, or AHA. So he talked about how the rates of chronic disease have been growing. He said that cancer increased dramatically as our department has grown. We're the sickest nation in the world. So he didn't cite any cancer incidence numbers. And this claim is kind of echoing a story that Paul wrote a couple of weeks ago, about Trump's executive order that drew on some kind of fringe data from researchers in Wuhan, China. This one study suggested that cancer incidence had increased, but it was contradicted by some data. A lot of data from U.S. registries that was published by NCI and CDC and ACS. We're not sure exactly where this data is coming from. He didn't, like I said, cite it or provide any reference for those numbers. But something that's important to note is that he and Trump, kind of when they mention this data, they don't kind of conveniently leave out the fact that mortality from cancer has decreased. And, this is due to improvements in early detection, treatment, and overall healthcare, obviously. The heart of the message was that, this isn't a problem that can be solved by money, that throwing RFK's message, throwing money at the problem hasn't fixed anything yet. So why would we expect it to in the future? So that was kind of his justification for these massive cuts.
Do you, no worries if not, but did, just circling back to like the actual specific consolidation and, what actually is going to happen. Do we have any info about what's happening at NCI specifically, or what will happen?
Yes. Let's see what I have here. Nothing official in the document that we put into the story. So we have info for FDA and CDC, NIH and CMS.
Yeah. Claire, what has the response been from oncology to, RFK and just this stuff in general?
Yeah. So American Cancer Society's Wayne Frederick, the interim chief executive officer of ACS-CAN, and a practicing cancer surgeon, wrote up a statement and kind of a lengthy critique of these cuts and restructuring. There was one quote in there that I thought was really pertinent to us. He said that for the last 50 years, every major medical breakthrough can be traced back to investments in NIH, which houses NCI. So,
yeah, absolutely.
Yeah.
Yeah. And I mean, that's basically exactly what, the small pieces of the roundup that I contributed was the NIH forum on basically just what's happening at NIH and why it's bad was basically the gist of the forum.
Yeah.
But it was really powerful because the people who were on the panel as like witnesses are, leaders in, it was oncology and Alzheimer's research and ALS. But obviously we're going to focus on the oncology piece of it. And, one of them was Monica Bertagnoli, former NIH and NCI director. But both of the oncology sort of, again, quote unquote witnesses, it feels weird to call them that. Like it's not a trial, but, the people that were there, they are cancer survivors themselves. And, both of them said that they, would not be there as they are if it wasn't for the research that has been done at NIH and NCI specifically. Yeah. And I think I'm forgetting the numbers exactly, but both of them had participated in multiple clinical trials. So it's not even like, tried and true regimens. It's
straightforward treatment,
innovative, like the things that are happening now at NIH and NCI. So definitely an important thing for, real patients. And, again, this is a tired trope probably, but, it really does affect everyone, even the leadership of oncology itself. So,
right.
Yeah. So maybe we can transition a little bit into my story. I know, do we have anything else we wanted to cover from your story, Claire? I apologize.
No, it's okay. I think those are the highlights. Yeah. If you want to get into the documents, I mean, we have the whole transcript in the piece. I think it's really cool that we're doing full transcripts. I don't know, like as I've been covering this stuff for the cancer letter, I've become a much more informed citizen in general. Yeah. And I've been noticing how much more sort of informed and like up to date I feel when I'm reading like primary documents, and like really like actually watching the hearings and stuff like that. So I think I love that we include that stuff in our stories personally. Yeah, it does feel unique to the cancer letter instead of, this whole idea of gray boxing things and like putting in the whole thing and not interrupting a quote just because it's what journalists typically do. And it's also just nice to have, in a time when like a lot of stuff is being wiped, it's good to have. And it does feel like documentation. So I agree with you. Yeah, it's cool.
Yeah, for sure. So anyway, the DoD story was pretty crazy. I didn't expect it to be as crazy as it was. Honestly, we kind of assigned it on Monday and I was like, oh yeah, I'll write about this. It's, yet another casualty in everything that's happening right now. The CDMRP, the Congressionally Directed Medical Research Program, basically saw a funding cut of 57%. And that's sort of this like wonky thing that happened because of the continuing resolution. I definitely dove deep into that in my reporting, but I ended up not including it too much in the story because it was complicated. And, ultimately what happened is that it was cut 57%. And that's just, this crazy gutting of the program. And what was interesting, and again, I didn't include this in the story because it sort of evolved over the week, was that when I first started reporting on it, we didn't know, and I was working closely with patient advocates from a couple different organizations, and nobody really knew exactly how that leftover, it was $650 million. So before in FY24, the funding for CDMRP, the umbrella program was $1.5 billion, and then it was cut to $650 million. That's the 57% cut. And at the beginning of the week, nobody knew how exactly that $650 million was going to be distributed to the 35 research programs that are under the CDMRP. That's 35 programs. A bunch of them are cancer, not all of them though. And that's when I was speaking with NBCC, and that was one of their main concerns was, how are we gonna, there's no, the typical process involved in distributing these funds has been totally cut off, and it's totally just up to DoD how they're going to distribute these funds. In the past, again, this is like pretty complicated, policy level stuff. But there is like a very strict process, including advocacy and letters and like letters of support, public letters of support by Congress members and things like that. And all of that is cut out, and it's again just based on what the DoD wants to do. Then on, I think it was Thursday, maybe Wednesday, CDMRP came out with their funding, allocations, and we all had to sort of like scramble and figure out what that meant. And in that, we found out that the lung, pancreatic, and kidney cancer research programs were just cut. They're just gone. And that was really shocking because, these programs, these were some of the newer programs, but like the breast cancer research program has been around since 1991. They've gotten like pretty consistent funding over the course of the last 33 years. And this funding mechanism has helped a lot of people because it's pretty unique in the terms of the type of projects it funds. So DoD is known for funding higher risk, higher reward research. So where NIH is more known for funding like incremental research based on really rigorous research, rigorous science, that is more of a sure thing. Obviously, that's not always the case with research, but more of a sure thing. Whereas DoD really is fueled by these more higher risk, potentially breakthrough projects. And the DoD is also unique in that they have patient advocates involved in the decision making of which of these grants gets funded and like how, all of basically the advocates said that at every table where decisions are being made, there is a patient advocate there. Yeah. And I think that's really interesting because, basically those two things taken together, the high risk and the patient advocates, mean that the work done at the DoD is, really oriented toward making patients' lives better. It's, it's the whether or not the scientific question is like interesting or, all of these other factors that go into, NIH grants are secondary to whether or not it helps patients quickly. So it's definitely a unique funding mechanism. And I think it's important to say that because the lung cancer, pancreatic cancer, and kidney cancer programs, they didn't have like the most funding in the world. Like the pancreatic cancer research program was given $15 million in FY24, and that's what they lost. And, compared that to the breast cancer research program saw a $20 million cut. So their cut was more than the entire pancreatic research cancer program. But it's, these dollars, I think this is actually a great quote by Julie Fleshman, the president and CEO of the Pancreatic Cancer Action Network. She says, these dollars were important to our community. It's very specifically these dollars because of the type of research that they fund, the type of questions that they fund. So, it was really intense. Definitely can talk more. I could talk more about it for hours probably, but it was a really intense week on my end, just sort of like working with the patient advocates to keep up to date on all of this and what does it mean. And obviously, it's just really hard and sad. Another, I think, quote also by Fleshman, like what does it say to patients and families and researchers when an entire program like this is just fully cut and destroyed. So it was intense. And it's like in the context of everything else that's happening, it's like yet another cut, but it's, I think being so involved in like this story wasn't part of a roundup. It was something I like reported on more deeply and really got into. And it hits different. It's intense. Yeah.
It's like humanized for you.
Yeah.
On a really personal level. Can you tell me a little bit about the kind of the backstory or the history of the DoD grant?
Yeah, it's so interesting. It's such a cool story. Basically, in 1991, I believe, the National Breast Cancer Coalition, which is NBCC, I think I used that just as an acronym earlier, but it's the National Breast Cancer Coalition, which is a group of activists. Basically, they noticed that there was a lot of funding and messaging about breast cancer awareness. And they were like, no, we need funding going toward breast cancer research, like treatment, prevention, screening, that type of thing. And they wanted more funding. There was funding at NCI for breast cancer research, but there wasn't a dedicated program. So Melanie Wine, who's the chief policy officer of NBCC, I spoke with her this week. And she basically gave me sort of the rundown. And the cancer letter has covered this, firsthand. Paul, covered this as it was happening. But yeah, it was basically that they wanted more funding for breast cancer research. And I think this is from actually our coverage of it, but the idea was that they learned from AIDS advocates about how to actually push for funding. And the president of NBCC, the now president also of NBCC, was just this like fierce advocate and just absolutely demanded $300 million for additional dollars for breast cancer research. And it was really interesting to read sort of the history at that point. And I don't think that this was in my story. I think it was actually in our in the archives story for last week. But how at that time NCI, NIH, professional societies, they all thought that was a crazy number to ask for. And Fran Visco and NBCC, they just made it happen. They worked with Tom Harkin, at the time, who was the chair of the DoD Appropriations Subcommittee, and basically did this like clever maneuvering to get additional funding for breast cancer research. And it happened to be through the Department of Defense. There's a really cool, I like this quote a lot from Melanie Wine, that the fact that it's, breast cancer research in the Department of Defense sounds very weird and incongruous, but it was a fluke of history because it was in peacetime and there was sort of like this extra funding that they were willing to spend on breast cancer research. So, definitely I could keep talking about this and maybe we might be going a little long. And that's, when you write a fun story like this, it's one of those things where you can just keep talking, but you, listeners, you guys can read more about this on the Cancer History Project. It's free. You don't need a subscription. And we have a lot of really cool coverage. We have a Q&A with Fran Visco, her telling the story from her first person perspective. We have coverage from Paul Goldberg as it was happening. It's a really cool story. Definitely worth reading more. There's pretty funny quotes. I think I included some, was the idea of like, we don't, NCI leader saying, we should be in control of the breast cancer research or cancer research in general, saying we certainly don't want our own B-2 bomber program. So it was really a saga in the 90s. So really interesting. And again, very jarring to see that, something with such a long history is now just been not gutted, because breast cancer research is okay-ish. So now that I've talked for hours about my little hyperfixation of the week.
No, it's super interesting. And it was very, probably one of our most linear episodes, I would say.
I know. We followed the schedule, actually.
Yeah.
Crazy.
Yeah.
Oh my gosh. But we miss Paul. He'll be back next week. All right. Well, thank you so much, Claire. This has been a joy. Again, like we said, very linear. But we'll miss Paul. We miss Paul, and we'll be happy to have him back and be more crazy next week. It'll be fun.
Sounds good.
Thank you so much, and tune in next week for more. Thank you for joining us on the Cancer Letter podcast, where we explore the stories shaping the future of oncology. For more in-depth reporting and analysis, visit us at cancerletter.com. With over 200 site license subscriptions, you may already have access through your workplace. If you found this episode valuable, don't forget to subscribe, rate, and share. Together, we'll keep the conversation going.
Until next time, stay informed, stay engaged, and thank you for listening.